Doctors here are preparing to treat the people who evacuated the Houston area.
And they say they're ready. News 8 health and wellness reporter Sonia Zod is in our Young Street newsroom with that part of the story. Sonia?
Well, John and Izzy, right now doctors are most concerned with the people who've been stranded in water for long periods of time without food or medicine. Their risk for infection is extremely high. Hospitals in Houston really don't have the ability to take in patients right away. Take a look at this here. This is what the medical center looks like. And if you're not familiar with Houston, this is where you'll find a cluster of 23 hospitals. So right now, all the roads around there are flooded with 2 to 3 feet of water. Patients have already been transferred from Ben Taub Hospital. NICU patients were flown from the Corpus Christi area to Dell Children's Hospital in Austin, as well as Cook's Children's in Fort Worth. And it is really all hands on deck here in Dallas as doctors, nurses, pharmacists, social workers will come together to treat and care for the 5,000 plus evacuees that we are expecting to arrive this week.
And medical safety really begins with the assessment of the patient. What are their vital signs? How do they look? What do they complain of? Is it vomiting? Is it diarrhea? Is it cough? Is it shortness of breath? And so on. And then we do assessments to see what their vital signs look like. What are their oxygen levels? Does there seem to be that they're having a medical emergency?
So I need to let you know that Children's Health will have pediatricians at that mega shelter at the convention center to help what's called low acuity patients, so kids whose needs aren't urgent. The more critical patients then will go to hospitals, and I've spoken with all of our local hospital systems. They are all equipped and ready to take in evacuees who have medical needs. I know that a lot of you want to help. Right now, the best way, as we've been telling you, is to donate money to Red Cross, donate blood as well if you can. If you're a medical professional and want to volunteer at the shelter, they will need you. You can email Dr. Fowler, who you just heard from, at ray.fowler@utsw.edu. I'm going to post that to my Facebook page. If you happen to miss it, you can connect with me on Facebook or Twitter, and I promise you I will get you to the right people. John?